November is National Diabetes Awareness Month, and it's a serious issue here in Ohio because every 23 seconds, someone is diagnosed with diabetes in this country. Diabetes is also the 7th leading cause of death in Ohio and the United States, more than AIDS and breast cancer combined. So joining us now with an urgent message about this epidemic in Ohio is Dr. Ronald Charles, Vice President of Medical Affairs with Buckeye Health Plan. How are you doing, Dr. Charles?
Good, good. How are you?
Good. So for people that don't know, what is diabetes exactly?
Diabetes is a disease where you have the body's inability to utilize the nutrients that is provided to it.
Got it. And why is it such a problem here in the Buckeye State?
Well, it's a problem due to the fact that we have a large number of people who are obese. It's estimated that nearly 10% of Ohio adults have been diagnosed with diabetes. If current trends continue in Ohio, 1 in 3 Ohioans will develop diabetes at some point in their life. Between 2000 and 2010, the prevalence of adult diabetes in Ohio grew 37%.
And what types of diabetes are there?
There's 2 types of diabetes. You have type 1 diabetes, which is about 5% of all the people with diabetes, and 5 to 10%, and that's due to the body's absolute inability to produce insulin. Usually that's diagnosed in children, adolescents, and very young adults. And then there's type 2 diabetes, which is the body's inability to utilize the insulin that's being produced.
Is there a certain segment, doctor, of people that are more at risk to getting type 2 diabetes?
Yes. You have some people who are genetically at risk for developing diabetes, and then you have, as I stated previously, people who are obese, and older individuals.
Got it. Dr. Charles, what are some of the complications linked with diabetes?
Diabetes can cause heart disease and kidney problems, foot amputation from nerve damage, cuts and ulcers that do not heal, poor vision, or even blindness.
My goodness. So what are the signs that people need to look for that could say they could potentially be diabetic?
Symptoms of diabetes include increased thirst, increased hunger, dry mouth, frequent urination, weight loss, feeling tired, blurred vision, numb hands, feet.
Dr. Charles, how can we reduce our risk of contracting or getting diabetes?
Certain things that you can do is making sure that you're eating a balanced diet, exercising, losing weight, limiting or avoiding tobacco and alcohol, and reducing stress.
How is Buckeye Health Plan helping patients manage their diabetes once they've been diagnosed?
By utilizing our disease management program, by using our case managers who are nurses who are geared specifically to help patients manage their disease process, educate them, and make sure that if there are certain barriers to their being able to control their diabetes, that we provide them the resources to do so.
That's amazing. And speaking of resources, for everyone watching, I know this is a lot of information, but it's so important. How can they stay connected, get more information, and even contact a doctor like yourself to help manage this?
They can do that by contacting Buckeye Health Plan at our website, contacting the Centers for Disease Control, contacting the American Diabetes Association.
Well, Dr. Charles, thank you so much for letting us come here today.
You're welcome.
Like Dr. Charles just shared, for all the information you need about the world of diabetes, all you have to do is visit the website, buckeyehealthplan.com.